Have you ever watched an adult film and wondered how those men managed to maintain perfect, rock hard erections for hours on end, under the glare of cameras, bright lights, directors barking orders, and dozens of crew members watching? Have you ever felt insecure, inadequate, or even defective because your own erections don't compare to what you see on screen? Have you tried imitating what you think those actors do, only to end up frustrated, anxious, or even dealing with erectile dysfunction? Have you wondered if they have some secret, a magic pill, or special technique that you don't know about? If you've ever compared yourself to porn actors, felt like your sexual performance doesn't measure up to what you see in those films, or simply want the unfiltered truth about what really happens behind the scenes, this message could free you from an unrealistic and dangerous pressure. I'm Dr. Sanchez, a specialist in preventive medicine and men's health. Today, I'm going to reveal exactly what porn actors do to maintain erections during grueling shoots, the serious risks they take, why you should never try to imitate them, and what you can do instead to achieve firm, reliable erections naturally and healthily. Stay with me until the end, because I'm going to debunk the most harmful myths in the porn industry and give you the scientific truth you need to protect your sexual health. To understand the reality behind erections in pornography, you first need to realize that what you see in those films isn't real, natural, or sustainable. Pornography is entertainment, a visual fantasy designed to arouse, not an accurate depiction of normal human sexuality. Professional porn actors aren't superhumans with supernatural sexual powers. They're workers in a highly demanding industry who rely on a combination of genetic selection, powerful medications, cinematic editing tricks, constant breaks, and, in many cases, long-term sacrifices to their sexual health to meet job demands. Scenes edited down to 20 or 30 minutes might have taken 3, 4, or even 6 hours to film, with multiple cuts, breaks, touch-ups, and camera tricks. The porn industry also selectively hires men who already have naturally very firm erections, larger penises, and a genetic ability to maintain erections under stress. Most ordinary men don't have these exceptional traits, and that's completely normal. But constant exposure to porn creates unrealistic expectations for millions of men, who then compare themselves to an impossible standard and end up feeling inadequate, anxious, and dysfunctional. Imagine the devastating psychological impact this comparison has on your sex life. You watch a porn film, the actor has a perfect instant erection that lasts the entire time without weakening. He doesn't need constant stimulation. It doesn't matter the position or interruptions. His erection stays rock hard. Then you try having sex with your partner. Your erection takes a bit longer to develop. You need stimulation, and when you change positions, you lose some firmness. Your mind immediately screams, "Something's wrong with you. You're not a real man. You can't perform like them." That anxiety and self-criticism trigger the release of adrenaline and cortisol, stress hormones that literally kill your erection. You enter a vicious cycle of performance anxiety. The more you worry about your erection, the worse it performs. You start avoiding sex. Your partner notices your withdrawal. Intimacy fades. Recent psychological studies have shown that excessive porn consumption is directly linked to a dramatic rise in erectile dysfunction among young men aged 20-30, a group that rarely had these issues before. The problem isn't your body, it's comparing yourself to a fake, unattainable standard. Many men, desperate to mimic what they see in porn, make dangerous mistakes that ruin their sexual health. Some start taking Viagra or Cialis without a prescription, buying counterfeit pills online without knowing about cardiovascular risks. Others combine multiple drugs, overdose without supervision, or mix them with alcohol and recreational drugs, creating potentially deadly combinations. Some use extreme vacuum devices, constriction rings left on for hours, causing tissue damage, or unapproved penile injections. And many become so obsessed with performing like in porn that they destroy the spontaneity, pleasure, and emotional connection of real sex, turning it into an anxious, mechanical act. Before you fall into these traps, let me reveal the unfiltered truth about what porn actors really do and why you should never imitate them. The primary tool used by professional male porn actors is high dose PDE5 inhibitors like Viagra, Cialis, or Levitra. Nearly all male performers take these drugs before every shoot, not because they have natural erectile dysfunction, but because filming conditions are extremely anti-erotic. Surrounded by cameras, harsh lights, crew watching, directors shouting instructions, constant stops and restarts, and awkward positions for camera angles. All this kills natural arousal. The drugs ensure an erection persists regardless of stress and pressure. But here's the danger. Many actors take doses far higher than medically recommended. Standard sildenafil is 50-100 mg. Some take 200-300 mg. This dramatically increases risks of severe headaches, vision problems, priapism, painful erection lasting over 4 hours, which can cause permanent damage, dangerous blood pressure drops, and even heart attacks. Chronic high-dose use can also lead to psychological and physical dependence, making natural erections impossible without medication. The second, less known but very common technique is penile injections of prostaglandin E1, alprostadil, often as Caverject, or combinations like Trimix, papaverine. These are injected directly into the base of the penis, causing an immediate, rigid erection lasting 1 to 3 hours, regardless of arousal, essentially a forced chemical erection. This is used in legitimate medicine for severe ED unresponsive to pills, but always under strict medical supervision with controlled doses. In porn, some actors self-inject regularly without proper oversight. Risks are terrifying. Severe priapism requiring emergency surgical drainage, erectile tissue fibrosis leading to permanent penile deformity, infections from non-sterile technique, blood vessel nerve damage, and addiction to the method. Former actors have reported developing permanent, irreversible ED after years of injections, now relying on penile prostheses. The third strategy is constriction rings, cock rings, made of rubber, metal, or silicone, placed at the base of an erect penis. They compress veins to trap blood, keeping the erection firmer and longer. Used correctly for short periods, max 20-30 minutes with proper fit, they're relatively safe. But in hour-long shoots, many leave them on dangerously long, risking tissue damage from lack of oxygenation, penile vein thrombosis, severe swelling, nerve compression, loss of sensation, and, in extreme cases, tissue necrosis requiring reconstructive surgery. Chronic use of tight rings can cause permanent vein fibrosis and worsening natural erectile function. The fourth technique is vacuum pumps used just before scenes. These create negative pressure to force blood in, generating a temporary erection. Actors use them between takes to reload quickly. Combined with a constriction ring, they maintain firmness longer, but overuse can rupture small blood vessels, cause bruising, skin blisters, and erectile tissue damage. The fifth, often overlooked tool is cinematic editing. What looks like a continuous 30-minute erection is actually fragments from multiple takes stitched together with 10-30-minute breaks where the actor rests, rehydrates, pumps, or reinjects. Now, what's the price these actors pay for this unnatural standard? Occupational health studies in the porn industry show alarmingly high rates of premature erectile dysfunction in actors with over 5 years' experience. Many develop porn-induced desensitization. Their brains become so habituated that they only get aroused by increasingly extreme stimuli, losing the ability for erections in normal real-life situations. Constant performance pressure also leads to high rates of anxiety, depression, substance abuse, and relationship problems. Many former actors have spoken publicly about how the industry destroyed their sexual health, self-esteem, and genuine intimacy. They're not superhumans, they're workers sacrificing health for a paycheck. So, what should you do for firm, reliable erections naturally and healthily without mimicking porn? First, stop the comparison. Accept that porn is edited fiction, not a real standard. Your erection doesn't need to be instant, last 2 hours, or be perfect every second. A normal erection develops in 1 to 5 minutes with proper stimulation. It's normal for firmness to fluctuate, for positions to require more stimulation, and for stress, fatigue, or anxiety to temporarily affect it. This is real human sexuality. Second, communicate openly with your partner about insecurities. You'll find she values emotional connection, foreplay, attention to her pleasure, and communication far more than a robotic perfect erection. Third, prioritize cardiovascular, hormonal, and mental health. Exercise regularly, eat well, sleep enough, manage stress, quit smoking, and moderate alcohol. A healthy body produces healthy erections. Fourth, if you have real erection difficulties, see a urologist. Safe, supervised medical treatments exist. Using Viagra or Cialis under proper prescription and dosing after cardiovascular check is effective and safe, but never self-medicate imitating porn. Fifth, drastically reduce or eliminate porn consumption, especially if it's affecting arousal with real partners. Give your brain time to reset its sexual reward system. Many men quitting porn for 3 to 6 months report dramatic improvements in natural erectile function, desire for their partner, and sexual satisfaction. Sixth, practice Kegel exercises, sexual mindfulness techniques, and focus on pleasure, not performance. Sex is for enjoyment, not acting. Imagine Raul, 48 years old. For years, he consumed porn daily and started having erection issues with his wife. He felt inadequate compared to porn actors and even bought unregulated Viagra online. One day, he had a severe blood pressure drop and ended up in the ER. That scare woke him up. He saw a urologist who explained the reality of porn. Raul quit porn completely for 6 months, started couples sex therapy, improved his health with exercise and diet. Within 4 months, his natural erections returned stronger than ever. His sex life transformed. Not by imitating porn, but by stopping comparisons to a lie. It's crucial to understand porn actors aren't role models. They're workers in an industry that exploits their bodies, often leaving permanent damage. You don't need porn star erections. You need functional, healthy ones for a satisfying sex life with your partner. Achieve that through health, communication, education, and self-acceptance. You don't have to live comparing yourself to an unrealistic fantasy. You can free yourself from that destructive pressure and enjoy authentic, fulfilling, healthy sexuality. If this has opened your eyes, like, subscribe, turn on notifications, and share. Thousands of men are ruining their sexual health trying to imitate porn. Help them by sharing this truth. I'm Dr. Sanchez. See you soon.